Welcome everyone to today's webinar, How to Improve Caregiver Satisfaction and Retention with Mobile Technology. I'm Bob Holly with Home Healthcare News, and I'm going to be your moderator for this discussion. This webinar is brought to you by Skedulo, so a big thank you to them for putting this conversation together. Before we meet our speakers in just a second, I wanted to go over a few housekeeping items. First, please note that your audio has been muted. That's to ensure sound quality. We can't hear you, but if you have any questions, you could send those our way using the question function on your screens. Next, this webinar is being recorded. If you miss anything, don't worry, we have you covered. All attendees are going to receive a replay of this presentation, so keep a lookout for that in your email inbox. All right, well, with that out of the way, I think I'd like to welcome our speakers and give them each a chance to briefly introduce themselves. We have Jim Powell, CEO of Long Island Select Healthcare. We have Rachel Disselkamp, Director of Skedulo's Healthcare Vertical. We also have Kelley Smith, Chief Clinical Officer with Envision Health. Jim, welcome. I guess, why don't you kick things off and introduce yourself, and then we'll meet Rachel and Kelley next.
Well, thanks, Bob. Jim Powell, I'm the Chief Executive Officer for Long Island Select Healthcare in New York. We are a federally qualified health center. And what's unique about us is although we have a brick and mortar structure to our health center, we offer 16 different services. We have a real big, robust mobile practice where we try to deliver as much care as possible, specifically with the pandemic and the needs to bring more care and access to those at home.
All right, thank you, Jim. Rachel, thanks for being here today.
Thanks, Bob. As mentioned, I'm Rachel Disselkamp, the Director of the Healthcare Vertical here at Skedulo, which means that I run the global practice and portfolio of solutions that support our healthcare vertical. I support both customers and prospects, so I act as a subject matter expert, a technology advocate, and an executive guide, everything from pre-sales to post-implementation. So for me, success is happy customers, excellent products, and better outcomes for the industry.
Thank you, Rachel. And last but not least, Kelley, could you please introduce yourself to our attendees?
Sure. My name is Kelley Smith. I am a nurse by training. I have a master's in public health. I've spent about half my career in the healthcare business side, working with General Motors as a healthcare consultant, and then half on the clinical side, working as a home healthcare nurse, as well as a case manager at several different hospitals. Currently, I'm the Chief Clinical Officer at Envision Health, and I'm just very, very passionate about this work and truly understand both the joys and challenges of home healthcare, and I'm honored to be a participant here.
Very cool background. I love the mix of experts that we have on this webinar today. Well, now that everybody has had a chance to introduce themselves, I guess let's go ahead and dive into the discussion. Jim, I think the first question I have is for you. With respect to your team of mobile caregivers, what are the biggest challenges that you're currently facing?
Well, it's interesting. Our program really began about 2014. So from then to now, it's really been about that transition from transactional services, fee-for-service to value-based proposition. So it's not about how often we see an individual. It's the quality metrics, assessing the risk, and educating everyone, whether it's the patient or the providers, the caregivers, how important that is in our long-term view of things. With that said, I think that the other piece is how do you look at technology? We have existing EHRs, we have existing software. How do you integrate those and make sure the platforms are kind of more complementary? Things are so siloed in the world of healthcare. You got to be conscious of how you integrate those together. And with all that on top, you try to figure out how do you minimize turnover for staff. I think one of the things we've spent a lot of time with, we've been honored to be a top employee in Long Island for 2 years in a row for 2021. And part of it is looking about what specifically are the needs of our staff members and how we maximize their opportunities to either stay within the company and feel purpose with what they're doing.
What, just for our attendees to get a good sense of your organization, what does your overall staff mix look like?
So we have a breakdown from clinical providers all the way down to front desk staff. So we have providers, psychiatrists, dentists, primary care providers, subspecialists, nursing, medical assistants, care coordinators, remote patient monitoring members. So just the whole gamut of what we call part of our hybrid model of care.
All right, well, thank you for that. Rachel, I think question number 2 that I have is going to be for you. You obviously have a great perspective on what different healthcare providers are doing. What kinds of retention strategies and initiatives do you see other organizations using?
Yeah, and I want to touch on 2 of the items that Jim brought up and kind of pull that theme forward, which is the value-based care transition and turnover overall. So as Jim mentioned, that we've seen this conversion from fee for service to value-based care, which means that we've moved from a pay per service to a pay per outcome. And in many ways, this is a seismic shift from a reimbursement perspective. But in other ways, it hasn't as much shifted, but added additional things because providers are still having to track those services and determine costs, but they're also trying to figure out how much time it takes to complete them. And we're seeing different ways that providers are trying to recruit and deploy the labor to meet those outcomes. And it's really been additive over time. So we're all familiar with the concept of a staff nurse who works a standard or rotating shift schedule. But these arrangements are actually more facility-based. And in the home and community care space, we see a lot of different types of employment type statuses. So you've got clinicians who are paid by the appointment or visit, then you've got more employee-based who are paid by the hour or paid salary. And so you've got this blend of not only different roles, but also those who want full-time work or just picking up a few shifts here and there to keep up their license. Or those who have joined contract agencies and are working on more of a contingent basis. So they all want to manage their time in the way that makes sense to them. So for your per diem nurses, they're getting paid by the job. So they're really managing their own time, their own schedules, whereas others are looking for more consistency and less risk. So they look for things like guaranteed hours, which protect their wages from last minute cancellations from the client. And I've even seen some organizations use overtime as an incentive. So really the schedule becomes part of the negotiation, not only for hiring, but for continued retention and satisfaction, because workers are getting smart and they recognize that the schedule is really dictating how much take-home pay they have, the benefits that they qualify for. So it's important for organizations to start measuring that total hours versus what the expectation is, because if you've got an employee or worker that expects to be working 40, 50, 60 hours a week and they're only getting up to 30, they're starting to look for other options, which becomes a turnover issue for you.
Yeah, those exact points you just made were a big theme at our home care conference last week. We had a couple panels on recruitment and retention. And I think, the main thing that stood out to me was it's not just compensation, it's not bonuses, it's not higher wages. Home health and home care operators really need to tout that flexibility that they could provide to whatever class of worker that they're dealing with. Just to piggyback off of those comments. Kelley, I think I want to go to you next with question number 3. Today, we see many employers offering higher wages, sign-on bonuses, other financial perks to attract and recruit workers. What practical changes are employers making that really make a difference in employee retention in your view?
Well, I think first off, to set the stage on why this is such an important question, it's really important to remember that, especially in home care, nurses and other caregivers develop really strong relationships with their clients, whether it's just traditional home care, hospice, what have you. You're in their home, you're in their private residence, and so it's really important to remember that it's a different relationship than in a hospital. And so in a hospital, you see your floor staff nurses come and go, and you know them for a shift, and then they may or may not be back the next day. But typically and appropriately in home care, you want your nurses to be consistent, and all of your clinicians, your PTs, your OTs, your STs, your aides, especially your aides. You're invading their privacy, these patients, and so that's really important. And I think it's critical to remember that you need to make sure that these patients, that you realize that the patients might leave you or the agency if the caregivers leave. And so if the caregivers get burnt out or disengaged or frustrated, they're going to say, I'm going to agency down the street because I can potentially make more money, and they might offer me better benefits. So I think that's really important. And obviously that turnover can lead to lost revenue for the home care agency. So I think one of the things obviously is spending more time to orient, to onboard, train the caregivers. You need to let them know that you care about them, that you're not just, like a factory and come in, here's all your stuff, here's your equipment, here's your patient list, boom, go. And then come back and tell me, what great outcomes you've achieved during your visits. So I think that's really, really important, is you need to feel like you're cared for and truly an important part of the organization. The other thing is just instituting more reward and recognition programs. I think that's really important. These caregivers work independently to a large extent, and they don't have the benefit of a nursing supervisor or manager or quality director or chief nursing officer or whomever to say, hey, Rachel, what a great job you just did. I watched you, I saw what you did with that family and how important those relationships are and that experience that you had. So they don't get to see that. So you leave kind of every day feeling like, gosh, what did I do? I mean, when I was at home health care caregiver, one of my first patients was a little child named Brad. He was 11. He was hit by a car and he was a quadriplegic. And it was a really, really challenging case for me. And, I had to establish trust, and it took many, many weeks. And, but once I got there, I was like, wow, this is wonderful. But I had no one, I knew myself what I was doing, but I had no one to be like, I can see how you manage those struggles. So I think that's something that's really important for us to remember. And then focusing on a culture of, again, support and communication, because they're alone. They're autonomous workers, which is wonderful, but we all need communication, right? And support from our peers. And flexible scheduling, like Rachel said. I mean, that is just so important. And especially in nursing these days, it's very common in hospitals, especially, to be able to have, 5 8-hour days, 4 10-hour days, 3 12-hour shifts that count as a full week. Some people prefer only to work on weekends, crazy as it sounds. I had some of my nursing friends that only wanted to work on holidays. They got paid a lot of extra money, and they didn't celebrate necessarily with family. So that's all those different components are very hard to, to make sure you can make happen without that flexible scheduling. So I think that's really, really important right now. And then, it's not, no surprise, but an annual retention bonus is obviously something that's very important, because that, kind of, if you're coming towards the, 6 months in and that you're going to get a bonus if you stay another 6 months. I mean, money is important, as well as the other parts of, job satisfaction. Some of the things that I think some of the employers are doing right now is offering education reimbursement benefits. I think that's particularly important to some of the younger, the millennials. I know I see that in my role right now. We're like, well, are you going to reimburse me for any, additional education? And so they want to expand their career during that same time. And then finally, just providing resources, whether it's a phone allowance, whether it's, gas cards. There's an agency in Detroit that used to recruit me all the time, and they actually gave a car allowance, not an allowance, they leased a car for you. So there are all sorts of things that employers need to do, and I think they are starting to do it, because it's a very competitive industry right now.
Kelley, I think you just really emphasized the fact that there's no one magic bullet to staffing success. It's a combination of things, flexible scheduling, but also consistent scheduling at times, compensation, education, reward recognition programs. Jim, from somebody who lives this world day in and day out, what are the strategies that you're using at your organization, and what are some of the results you're seeing? Question 4 will go to you.
Well, for us, I think it begins with looking at how do you combine purpose and profit together, and that you send that message to the people and the organizations that you help support. So we actually changed one of our core values in the organization to be about wellness, and we define wellness based on 4 different categories. It's medical, behavioral, social, financial. So a lot of the workflows that we have created is not just for the employees, but for the patients. So if we all think about wellness together, it has opportunities for us to kind of improve ourselves and the quality of care we provide. So in doing so, we look at the work that individuals do, and can that be done remote? What can be done on site? And how do we maximize that opportunity for them to do remote work if needed? So for example, some of my lower paying team members may not be able to have access to the cell phones, access to the internet, access to services. So we want to make sure that we provide the technology for them on us, so that zip code and/or salary doesn't depend on who can work remote and who cannot work remote. We want to create more opportunities for growth. So we train a lot of students, whether it's social worker students or medical assistant students and such. So we're actually now in the process of trying to get some of these educational partners that we have to give us credits that we can give to the team members so they can pursue further education down the road. And then one of the things that we're proud of that we've done recently was we partnered with a company called Vita. And so it cost us about $8,000 a year, but it gives all our employees life coaches and access to information about how to enhance the medical and the behavioral wellness of the individuals that we support. So we do that. So anyone who is an employee of us and anyone who lives in their house who's over 18 has access to the app. And we felt this really made a difference in terms of the morale and letting the people see that the organization is really supporting them as much as possible.
It's so interesting in the healthcare world today. You have to be thinking about wellness just not in terms of your patient or client population, but you have to be thinking of wellness with your staffing population as well.
Right.
Rachel, let's go back to you with question number 5 here. What kinds of initiatives, technological or otherwise, have you seen incorporated into different settings, and what differences have they made for caregivers?
So, Bob, I think for as much as any vendor talks about metrics and data, especially as it relates to retention and satisfaction, I would say that most organizations are still struggling to consistently measure them. Because a lot of times it's because we don't really measure or examine the things close enough to where and when the work happens. And so oftentimes I find myself in conversations with HR professionals with that and also ops in the same room to talk about, well, we have these shared goals. We need to have the right staff at the right time, right place. But then we also have HR's perspective of having the right culture in place and having consistently engaged employees. So Jim talked about providing workers with opportunity for career growth, which definitely impacts satisfaction and retention overall in your workforce. And this is something that, again, can be a little bit nebulous outside of the traditional or acute care settings where you've got clear promotion paths or different departments and disciplines that you transfer and move between. In mobile or home and community-based services in healthcare, to help spot retention and satisfaction problems before they arise, I really advise that clients look at metrics that are related to how the work gets done, so actually within the schedule. So for example, if you have clinicians that are driving to homes to perform care, it's about measuring not only the average drive time, but also looking at the gaps between appointments or the instances where appointments ended up going later and causing lateness and backups for the entire day. And so managing healthcare in the field comes with so many challenges, and travel is just one, and often people stop at that average, but really looking at the details is important. The second one that I want to talk about, and I was mentioning it earlier, is measuring the specific days or the amount of time that individuals work. And Kelley mentioned weekends. So weekends are a tough one. Some people love working it because of the pay premiums and that sort of thing. But if by working a weekend, you've got your workers missing out on kids' soccer tournaments or date night or Saturday morning golf with the guys, this is going to create friction. And because, again, they're working on their own, they're not like seeing a bunch of buddies when they show up for work that day. Savvy organizations, I've noticed, are monitoring the number of weekend jobs that the individuals have to work. And they're using schedule data as a form of fairness data and equity data to make sure that nobody gets stuck with the weekend shifts when they don't want to work it. And then finally, there's a lot of really good metadata within your schedule, job, appointment, visit data, which means that you can indicate or you can find the risks and warning signs of turnover and satisfaction through some of the specific, even like data level fields. So for example, something I see in hospice a lot are death encounters. So sensitive organizations are actually setting thresholds and monitoring the number of death encounters that care workers experience, because too many in a shortened period of time can lead to emotional overload, stress, and ultimately turnover. But it's not just that level of impact. You can also look at the type of work that individuals are performing. So, or the criticality of the patient, as Kelley mentioned. So for example, if you've got a lot of senior clinicians and RNs doing a lot of LPN or CNA kind of work, it starts to grind on them because they're feeling like we're not performing at the top of our license. And it leads them to disengage and look elsewhere. So again, you can look to the schedule to see what type of work individuals are doing and link that back to their satisfaction scores, your retention metrics. Because culturally, many of us see the schedule as just a necessary part of the work, but it really can be a gold mine for insights into strategic business questions.
Yeah. One of the examples you just mentioned was that death encounter metric. And I know a lot of the providers we talk to on a regular basis have been looking at that over the last 2 years and drawing insights between their hospice staff and their home health staff. A hospice nurse has a very different experience with death encounters. They have different training associated with it than a home health nurse who maybe isn't exposed to it as much. Kelley, have there been any drawbacks to implementing technology for your teams in your view?
There are definitely drawbacks and challenges. I'd say the good news is that there was a recent survey I just found. They surveyed over 600 professional nurses, and they found that 82% agree that new technology and equipment innovation will positively impact patient care. So I think we all know that. I do know when I was a nurse in the hospital, though, when they were implementing a new EHR like Epic, and I know the physicians and the nurses were crazy. The doctors would call me aside and like, Kelley, you have to put these orders in for me. I don't have time. I'm like, I can't legally do that. They're like, well, you're gonna have to sit here with me because it's gonna take forever. So sometimes there's definitely resistance. I think there's more resistance to technology and equipment among some of the older, I hate to say it, because I'm creeping up there myself, but some of us who have been in the profession a long time and aren't necessarily used to all this, and a lot of technology is being forced upon some of these nurses, I think, especially in home care, because in home care traditionally, a lot of it was paper-based, and you would take your notes and you go transcribe them, and and you call it a day. And now they're being forced to look at all these different things on different devices. There are always concerns in the homes that the technology may not work because it's not like a hospital that you go in and your internet's there, and if it's not, you've got a backup upon backup on backup. If the Wi-Fi is not working, that can definitely cause stress for these any caregivers, because you're out there by yourself. You can't call your tech guy next door and have him or her come and fix your equipment. I think something that's kind of obvious, but millennials they expect the cool factor in technology. Everything's got to be fast, intuitive, bright, so easy to use, and they need to know that it's going to impact or increase their productivity and their workflows, and as opposed to hamper their efforts because they're quick. So that's definitely something you have to be, if you're introducing new technology, it better be tried and true, or you will get pushback. And healthcare professionals are not quiet people, including myself. We tend to speak our minds. So that's just something to be, aware of. And, also understand that the transition to new technology does take time. And I think you need to be very careful and diligent in your efforts with your team to say, look, we're going to introduce this, over the next, whatever the time frame is, but we're here for you. We have people to train you. We have a help desk, or here's my cell phone number, give me a call back and I will help you. Because again, when you're out in the field and that it's imperative that you're charting this information on the, patients, it's really important information. You can really feel stuck with that technology if you don't, if you haven't been given enough of the training. I think always cybersecurity is a concern these days, and making sure that your device is safe. You certainly don't want to be that nurse, PTOT, social worker, whomever in the hospital or in the home agency that causes a breach. So, that's important. And then cost is an issue. I mean, you need to spend the dedicated time and money to train and then continue to support that technology. And I think sometimes that gets forgotten. It's kind of like, come on, we did the training, get on with it. We need to, move forward. So just some of the things that are a little bit challenging when you implement new technology.
All right, well, the questions from the audience are starting to roll in. Just a reminder that we're going to get to those after we wrap up what we originally had on the agenda. And I think we only have one more question here before we do dive into audience Q&A. Jim, let's wrap up this portion of the webinar with one more question to you. patient satisfaction is the foundation of worker and company satisfaction. At your operations, do you use ENPS? Does your team leverage that? And if so, what kinds of questions do you ask to get a sense of satisfaction and engagement?
So I'll start off by saying, as a nonprofit, we actually have patient satisfaction complaints and compliments built into our monthly meetings that goes to the board. And over the years, I've actually changed my mindset of stopping to think that patient satisfaction is an Instagram heart or a Facebook like, to thinking it as a just culture type of mindset, where we try to teach our staff and our patients that this is an opportunity. Well, yes, you can get a compliment, but it's also a way for us to learn and think about how we can remain nimble as an organization. So we try to leverage that type of mindset, thinking about, well, asking open-ended questions if possible, talk about access, talk about engagement, talk about some outcomes to see if we can take some information and get some themes and then build on that for the next layers of what we're trying to do. Because, patient engagement and patient access is a forever vision that you never get to where you want to be, but you keep pushing through. And if you leverage the satisfaction surveys the right way, it definitely will help move you along in the right direction.
Yeah. All right. Well, thank you guys for putting up with my questions for you. Let's now jump into some of the audience questions. And I think let's start here. Rachel, Kelley, this seems like a good question for you guys. Home healthcare has changed the environment of where work happens. How does that affect worker and patient satisfaction? Rachel, let's maybe start with you, and then Kelley, hear from you.
Yeah. So this is a big one that we run into as we're going through the implementation process with customers and learning about how work happens. And when you think about home visits, it doesn't just start with the encounter and the care plan and getting all that set up. There's actually some kind of more admin work that happens on the front end, which is often called like the environmental assessment, home assessment, safety assessment, because there's so many things to account for in this new environment called your home. So oftentimes we're seeing a care provider coming into the home prior to doing any sort of treatments or evaluations and just assessing the environment. Like, is there obstructed access through doorways due to furniture or tight working areas? If the patient is immobile, is there going to be lifting equipment available? And this is a really big pain point in home health care because there's so many different agencies and organizations working together. It's just so frustrating for both the patient or client and the clinician to show up before there's the equipment necessary to service and help that person. Then there are other things from a real safety perspective that, again, we don't think about in our homes, like where do you get rid of sharps or proper disposal of things like pathogens exposure and that sort of thing. And then the interruptions that we've all gotten very used to in our work from home life. But when you're a care provider in the home trying to do something with this patient, getting those unexpected interruptions from family, from pets, this can be difficult to get your job done in a consistent and quick fashion. So making sure that you assess all of those things before providing the care is important across the board. And if we just kind of tie all the way back to outcomes, right? Like the outcome-based care does require us to evaluate whether the home is the right place to do the care. And we know that that's patients' preference as that it becomes more of a growing request, but sometimes it does still make sense to use facilities and other places to provide the care because of those limitations within the home. So I think that we in the healthcare community have to be aware that while there are trends and things that are coming and are exciting and we want to do things that patients and clients want, there's also some realities about actually providing the best care and advising our patients and clients on the best way to provide that.
Kelley, anything that you'd like to add to what Rachel just said?
Yeah, I think the challenge, as Rachel has mentioned, is the whole coordination of care in the home. Because again, in an acute care setting, whether it's inpatient, ambulatory, wherever it is, you have access to lots of different people at any given time. So number one, if there's an emergency, you can push the button and people are there helping you right away. And so it can be a lonely, it can be a frightening kind of existence. But I think the really important part is in terms of coordinating that care if I send a patient home and my home care order says I need an RN twice a week, I want PT 3 times and OT twice a week for the next 4 weeks, let's say, it's really frustrating for the patient because we have to remind ourselves that patient satisfaction is really important here as well. It's not just about the caregivers and the workers. So the patients need to know that you have coordinated their care. And so when the patient gets home and the nurse arrives, the DME company should have already been there, and the oxygen should be delivered. The wound care nurse supplies should be there, and then the wound care nurse comes in after that, and she or he has everything that he or she needs to take care of that patient. But when it's not coordinated like that, and if the wound care nurse gets there and none of the equipment's there and patient hasn't been fully assessed, that can lead to a lot of frustration and on both the patient's side and the caregivers, because then you need to go and start all over again with your coordination. So again, it does go back to that scheduling and making sure that everything is just all lined up, makes for a much smoother piece of care, part of care.
Yep. Jim, safety is a large concern in home and community-based care generally. How does that play out at your organization?
Well, with our deployable model and the team members that go to the houses, we try to do as much legwork ahead of time. Who's in the house, what's the anticipated or expectations of the visit themselves, where in the community they are, what time of the day is the visit occurring. So just to kind of do as much prep work as possible to make the team member feel safe. But also let them know if they don't feel safe, they can stop, and which hasn't happened yet, but give them the capability to say, what, we'll come back again with somebody else. Do a ride along, have 2 team members come to this house, or this group home, to make sure that everyone's safe and the right care is provided. So you have to do as much work as you can do ahead of time. I think really makes a difference, but not be afraid to put the brakes on, when someone doesn't feel comfortable.
Yeah. Looking through the questions here, I think this one's probably good for all of you. So Jim, let's maybe start with you again and then go to Kelley and Rachel next. This is from somebody who it sounds like they haven't really implemented any retention recruitment technologies yet. Jim, what advice would you give to somebody who is interested in implementing technology that improves worker retention and satisfaction?
Well, the advice I usually start with is that you really have to have an agnostic workflow, that it's not the technology itself, it's the people and how they embrace, the change management as you adopt the technology. I still have scars from the EHR when I went back in the days of going from charts and I felt like all it did was add more work for me as a provider when I was seeing patients. I want the staff members and the team members to feel comfortable that we're going to learn how to use the technology to obtain a goal and not be, handcuffed or beholden to the technology piece itself.
Yeah, you have to see the purpose of it and not just it's technology for the sake of technology. Kelley, let's go to you next. Somebody who hasn't implemented any technology, what advice would you have for them at the onset?
I mean, I would just say perform really strong due diligence up front. Look at the different ratings for some of the types of technology that you're interested in. It's always been important to me to actually talk to another agency or hospital or what have you in person or whatever via Zoom and actually learn from them. Like how did this go for you? What were the barriers that you encountered? And then have a really good plan on the back end to say, okay, these are what barriers we're going to expect, and here's how we're going to address them. And just understand that when you go into healthcare as a clinician, you go into it to take care of patients. You really do, no matter what. And there's all sorts of technology you have to use, and it makes your workflow and your job better, and it improves the outcomes of the patients. But you have to remember that that's why these people went into that profession. And so you have to be a little bit patient, I think, in making sure that you do a little bit more hand-holding to help them understand the technology. They're not engineers, right? They're caregivers, and not that those of us who are in healthcare aren't technologically savvy, but sometimes it's not top of mind, so we might need a little extra help.
Rachel, I know Kelley and Jim just covered a lot of ground there. Anything that you'd like to add?
Well, I feel unfairly advantaged as the technology vendor in the room, but definitely want to reiterate Jim's point around going into an implementation with an understanding of the process that you want, not the technology you want to use. And this is critically important for healthcare because so many of our processes actually have been baked in because of the technology that we use. We kind of warp ourselves around like, okay, well, we have to gather this type of data in this type of way. But actually what's encouraging about the market now is that there are so many different providers that are flexible about the process that you would like to promote. So with saying that too, also look for partners within your process. So typically when you're looking to change something and get new technology in, you're not trying to necessarily preserve the status quo. So it is important to look for experts that can partner with you to say, well, you do it this way, but actually among other customers like you, we suggest this way. So having that point of view from the vendor's perspective can be very valuable. And then the final piece is around the metrics as well. So figuring out like the implementation being successful and going live is not the metric of success, right? Like the technology will go live, you will be on it eventually. It's really about understanding what outcomes that was meant to produce. And so what's been very effective among customers is when they can get out of the weeds of like, okay, well, we need to implement this and it's going to integrate here and there. They think about, okay, well, there's the clinician piece, which we have to involve, kind of train the trainer and these sessions where they learn how to use the technology. But how you push that up is incredibly important, especially to the decision maker or the buyer of the technology. So identifying what does it matter when I implement new scheduling technology to my market VP, to my director of, you know, even outside like director of supply chain or director of different operations. How can you communicate the success of what you've done with technology back into how that benefits the business? Because ultimately, the best technology comes alongside a big transformation within your business. The technology itself won't just be the forcing function. You have to have that alignment internally that you're going to get on board and ride the technology kind of to that next wave, that next place of being.
Yeah. We have at least one more question from the audience, and I'm going to try to condense it a little bit. And Rachel, they're asking it to you. What solutions has Skedulo implemented to support implementation barriers that might occur due to a clinician or caregiver's background? And by clinician or caregiver's backgrounds, they're specifically mentioning their tech literacy or their connectivity, maybe they're caregivers that work in highly rural areas. What's Skedulo doing to kind of make sure that the technology is equitable across different caregiver groups?
Absolutely, and that's a great question and one that we are very focused on internally. So we have recently stood up a part of the organization that focuses specifically on customer education, because there's implementation guides and release notes from a technology perspective that we're producing, but that can be kind of like, okay, well, that's how I put it into place, but how do I use it? So we're working through options for things like e-learning, where you would do preemptively before using the software, that you would go through a course or a series of courses that breaks it down kind of into 3 different levels. When I think about training and what you're trying to accomplish, there's the business level, like why did we get this? Then there's the functional level of if I'm a nurse and I'm working in the field, how, like, why am I using this? What is it going to help me with? And then finally, which buttons do you need to click to do which things, right? So we don't want to necessarily jump down to any one of those levels singularly. And previously our guides and things have focused really on that tactical, like this button does this and that button does that. But we're trying to build up the stack to answer that question of, okay, well, I don't really know why we got Skedulo and I don't really know why I should be using it. So trying to add that as a layer of context on top is something that we're building out, especially in 2022. So if you are a current customer of Skedulo, please reach out and I'm happy to coordinate a meeting with our new team internally.
And we just had another question roll in too. I was about to say our final question, but I think I spoke too soon. But somebody else wants to know, home health providers have to gear up for the home health value-based purchasing model. Next year is going to be, in a way, a pre-implementation year. Does mobile scheduling technology positively affect home health providers gearing up for that model? Rachel, has that been on your radar? Has Skedulo been looking at the HHVBP model and how it could play a role?
Yeah, absolutely. So obviously we're very connected to the value-based care models, but we partner and play well with the EHRs, which are also helping manage that piece of it. So we're helping to manage the outcome-based piece in a couple of ways. So I'm not exactly sure specifically which area, but I'll speak to some of the Medicaid and Medicare requirements for like EVV. That's something that we capture because we are a mobile first kind of organization. We're capturing those geolocation points wherever you are using the app. So as soon as you go in route, we're capturing the geolocation. As soon as you check in or start the job, we're capturing that location. Same with completion. So that's not only helpful from the outcome perspective of like you have to submit EVV reports and making sure that the services were conducted at the right place for the right patient, but also is a safety concern. So I know Jim talked about that earlier, but there is a level of ensuring that we know where that care provider is, and if they haven't shown up to the job after a certain period of time, that we have a trigger to the home office that says, hey, Kelley was supposed to clock in or show up to this particular job and she hasn't. We might want to reach out to her. So a little bit of a roundabout way, but I'm happy to discuss details if there are any additional ones.
And the last question that I'm seeing showing up in our inbox, Rachel, sorry to put you on the hot seat again, I think it's for you. And it's a very big picture question. Given the current challenges that we've described so far, how is Skedulo improving clinician retention? What are some of the key ways that Skedulo is doing that? I think maybe this is even a good question just to tie all the different threads together here at the end.
Yeah. So I would definitely go back to a lot of the things that I talked about with the questions. So really, at the end of the day, I'm using schedule data as the metrics to drive success for retention. And that's what I mentioned earlier on, like really measuring where the work happens, because that's what affects the satisfaction and retention. You don't go home at the end of the day and talk about the general vibe of the company. You talk about those specific instances where you didn't get the shifts that you wanted, or you didn't get the number of hours that you wanted. You're driving all the way across town to go see this patient. And so that's why measuring this sort of information using the metadata that Skedulo produces is what will help you enter that conversation with that employee, or if you're the employer worker with the business, to say, hey, I know that I'm only getting 25 hours a week and I signed up for full-time employment. Now, I'm going to find someplace else to make the ends meet, which is ultimately what often happens. But they can point back to the schedule, because Skedulo is capturing those jobs and say, look at the technology, look at what I've been scheduled for this week. It's not matching up to my expectation. And I've seen this across industries. Healthcare is just kind of getting on the same wavelength as like retail, because retail was in the same position, and then all of these fair scheduling laws came out to really curb, like, you have to get this number of hours. You can't like send out another shift until you give people advanced notice. So all of those things that we're building in, and the way that we think about our product, is ultimately trying to help our customers achieve those different outcomes. We're not out there trying to create the next best scheduling tool, although I love scheduling, so I could see that. But we are ultimately trying to do things like help you with more organic appointments, like patients coming to you and saying, I want an appointment at my home, or converting from a very clinic-centric model to a home care one. And that's tough. And you've got to convince the business that that's worth it. So you can use labels and tags and things within our system to say, well, actually, you went from 80% in the clinic to 50% in home over the course of the year. So those are the types of data pieces that we're capturing and can help provide you with really the business case to say that operations is really making an impact on retention and satisfaction.
Yeah. Well, thank you, Rachel. Kelley and Jim, unfortunately, I'm not seeing any audience questions for you, but before we wrap up, I think I'll just ask if either of you have any final remarks that you'd like to leave us with, or any responses to what Rachel just went over.
I mean, I guess I would just say, having been in the field, I do agree with you. I do agree that the software is critically important to make helping with the patient and the worker satisfaction. I want to make sure if I'm showing up at 8 o'clock in the morning for my with my ready to take care of my patients, that I've got an appointment from 8 to 9. I get a little bit of time in between, but then my next appointment's not going to be clear at the other side of town, because all that drive time, I don't get paid for that drive time. I get paid to see my patients. And, you know, again, it's not just about the money. Like I said before, it's about, you know, caring for these patients, but let's be honest, you don't want to be spending a lot of wasted time, you know. So a system like this, you can kind of input your time, input your geolocations, and, you know, it improves the satisfaction of the worker in the day, and then makes them in happier mood and better able to take care of their patients.
Jim, any final comments from you, even if it's just wishing our attendees a happy holidays?
Well, I think maybe you just took the words right out of my mouth, and thank you for allowing me to be part of this. And again, wish everyone happy holidays, and thank you so much.
All right. Well, I am the other questions, so I think it's a good point to wrap up. Jim, Rachel, Kelley, I learned a lot. Thank you so much for your time today. And of course, another big thank you to Skedulo for bringing all of us together. And lastly, a huge thank you to everybody who tuned in. Thanks for your time today, and we'll see you next time.
All right, Jim.
Thanks so much. Happy holidays.